Hello, good day. My name is Jeremiah Guzman, your student nurse for today. And as to start, may I know what your full name is?
My name is Rafael Omans and
And how would you like me to address me?
Rafael.
So, Mr. Rafael, just for verification purposes, may I know when is your birthday?
August 22, 2004.
Alright, so today I'm going to be assessing your eyes and ears. But for now, I'm going to close all the blinds and curtains for privacy. And the assessment of your eyes and ears involves touching you, if that's okay with you. And I'm going to, or rather, prior to assessing your eyes and ears, I'm going to ask you a few questions first. And rest assured that every piece of information that you will be giving to me is strictly confidential. That both of us will only know on the attending physician.
Okay.
Okay, so to start the question, do you have any disturbances with your eyes or any trouble hearing?
No.
Okay. Have you went to the hospital because of your eyes or ears?
No.
Do you have any familial diseases that you might have occurred,
No.
like diabetes? Okay. And lastly, in your everyday life, how long is your screen time?
About 8 hours.
And you like wearing, or how frequent do you wear earphones or earphones?
About 4 times a week.
So that is, I will take note of that. And now I'm going to begin assessing your eyes. Firstly, I'm going to inspect your eyebrows, eyelashes, and eyelids for symmetry. And as I can see right now, your eyebrows and eyelashes, the hair has been distributed similarly, and any patches or missing hairs or what. And now, as I can see right now, your eyelids doesn't have any upwards or any curvatures, multiple curvatures, and there's no swelling. And right now, sorry, to proceed, I'm going to touch your nasolacriminal glands, if that's okay with you. But for that, I'm going to wear gloves. Okay, now, so I finally wear my gloves and I'm going to palpate your nasolacriminal glands. If you do feel any disturbances or other discomforts and any pain, just inform me immediately. Do you feel pain?
No.
Right, that's good. You don't feel any pain, and as I touch, there are no masses or there are no leakage from your nasolacriminal glands. So that's which is good. Now I'm going to be inspecting now your palpebral conjunctiva and your bulbar conjunctiva, which means it is the inner skin of your eyes. I'm going to touch you. So I'm going to inspect first your right eye, and I'm going to look up. Swelling, no inflammations, or lesions whatsoever. I'm going to proceed to assessing or checking your palpebral conjunctiva, which is in the upper part.
Okay.
I'm going to use a button applicator so that I will find it easier. Kindly look down and close your eyes a little bit. If you feel any discomfort, just tell me immediately. Very good. Look up and think. So, know that your lids are now okay, and I do not see any notable findings or significant findings on the palpebral conjunctiva, which is good. Moving on, I'm going to inspect your sclera, your iris, and your cornea. As you can see right now, there are no disfigurements on the sclera. There are objects as well. Sclera is white. The cornea is transparent. It's not opaque. Then your iris round, and the color is evenly distributed. I'm going to check your pupil gauge. This is the size of your pupil. And you look straight to me. normal because the normal measurement is 5, which is good. And now I'm going to check and assess your pupillary light reflex. But firstly, I'm going to dim the room so that I can see that. Okay, now that I have dimmed the lights off or turned it off, I'm going to instruct you to look straight and I'm going to be assessing your light reflexes. So as you can see right now, your light reflexes is good. There's direct and consensual reflexes, meaning that your pupil is reactive, having a direct reflexes when I shine your pupil. When I shine your right eye, your right pupil constricts, and so does the other one, meaning there's consensual, and so forth from your left eye, which is good. Now I'm going to be checking your accommodation of your eyes, meaning I'm going to check if you can be able to adjust and focus your eyes while staring at an object. Can you stare at this? Okay, it's good. Your eyes will pupils whether it is reactive to accommodation, which is really great. And prior to testing your peripheral visions, I'm going now to turn on the lights. Now I'm going to be checking your peripheral visions since I turned on the lights. Use this index card to cover your right eye first. Cover it with your index card. I'm going to also cover my other eye. And I want you to say now if you cannot see my finger anymore. Okay?
Now. 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 Now.
I want you to rest first your eyes before I proceed to your other eye. Now that your eyes have been rested, I want you to cover your other eye. And I want you to do the same thing. If you cannot see the finger anymore, say now.
Now. Now. Now. Now. Now. Now.
Okay. The peripheral vision is good as I cannot see it the same way or the same time at the same time. And for the last part in the eyes, I'm going to test your near visual and distant activity. Now to start the distant visual activity, I'm going to assist you now. Can you please stand up? And I'm going to go there to point out the letters on the first line up until the line you can read. But firstly, I'm going to instruct you to cover your eye first. Okay. Now can you read the first line up until the line you can't read anymore?
E F P B O Z L E P D E E C F D. I can't read anymore.
Okay, so your left eye, right? You can only read 20, 40 distances, which is, I'm going to take note of it because the normal should be 20. Okay, I'm going to let your eyes rest first and we're going to do the same procedure. Okay, now proceeding to your other eye, can you cover your left eye now please? Okay, to check your right eye, I want you to read the first line up until the line you can't read anymore.
E F P B O Z L P E D E E C F D and E B F C Z P F E L O P C D. I can't read anymore.
Okay, so that is I will take note of it because your right eye can only read 20, 25 and then your left eye can read 20, 40. So to take note of it because both findings are not normal. I'm going now to test your near visual activity with this. Can you hold this for me? Since it is not pointed inches away from you, we're going to do the same process by I'm going to do the same process like in the distant visual activity, covering your eye immediately when you start. Please cover your right after me. And you read the first line up until the line end.
E L P F P H O L C F D H J B S E E P Z O C F D H J L P F E H.
That is good because your left eye, the pointing, which is good. However, there is one mistake that is still acceptable. And I want your eyes to rest first so that you can proceed to your left eye. Cover your left eye again, and I want you to make the same thing.
E L P F P H O L C F D H J B S E P P Z O C F D H J L P F E H.
First again, one more mistake, but overall, your near visual activity is good. However, I will take note of every information or every finding on the near visual activity, the far visual activity. Lastly, I'm going to be assessing your ears. And upon inspection from your ears, its place is there's no findings on the placement, there are no color disfigurations. It is aligned to your eye, which is good. And now I'm going to be touching your ears. Okay, that's okay with you. Okay, as I touch your ears, if you feel any pain or discomfort, just tell me immediately. I'm going to approach you from the end. Okay? Feel any pain? No. Okay, so since you have not feel any pain and I did not feel any lesions, I'm going to proceed to touching your mastoid process, which is located just behind your ear. And if you feel any discomfort or pain, just tell me immediately. Feel pain? No. That's good. Now, after touching you, I'm going to be looking inside your ear. Okay, so I'm going to check if there are foreign substances, if there is protrusions, or if there is impacted cerumen. Then you can see cerumen on your right ear.
And now,
Okay, and your ears are dry. Like this. Now, after checking inside your ear, I am going to perform whisper test. Instructing you stand up, but I'm going to be assisting you later as I'm going to stand up as well on your back, and I'm going to instruct you to lock your ear or plug your ear to the side where I want you to pull. Okay? And I want you to repeat the words that I'm going to whisper. Please stand here. Now can you block your left ear? And repeat the words that I will whisper.
Popcorn.
Football.
Football.
Okay? And then this on the other side.
Football. Popcorn.
Okay, so now we have done the whisper test. We're going to proceed to the next part. So, just to repeat it again, your whisper test is all done. We're going to proceed to the final assessment of the final procedure, which is performing the whisper test. However, even though you can repeat all the words exactly on the whisper test, it should not be repeated, but for the sake of the full assessment, I'm going to do this. I'm going to use this tuning fork. And tell me if you haven't hear any notification. Firstly, I'm going to approach you, Mr. Okay, now I'm going to place it on your forehead, and if you cannot hear it anymore, say now.
Now.
Right? Did you hear both left and right?
Yes.
Right. And meaning that you can hear the sounds of both left and ear, which is really good. And I'm going to perform the reading test. And firstly, I'm going to assess on your left ear and say now if you can't hear it on the air conduction and flow conduction.
Now.
We're going to do the same thing, but I'm going to place it on your last ear.
Now.
We're going to do the same thing on your right ear.
Now.
Lastly,
Now.
okay. Performing the reading test, the Weber test, there is no abnormal findings as you can hear both left and right. Your air conduction or the air conduction emitted the sound from tuning fork is longer than the bone conduction, which means it's good found in the left and left ear. So as to summarize everything up from the eyes, inspection, the distribution of your hair from eyebrows and eyelashes are all equal. There's no patchy hair losses, healthier conjunctiva, and then your bulbar conjunctiva. There's no lesions, there's no redness, inflammations, or what? And when touching your mesenteric terminal, there's no leakage. You do not also feel any pain. And your pupils are equal, round, reactive to light, accommodation. There's direct and consensual light reflexes. And you can be able to focus from the bed light on the accommodation reflexes. And your peripheral visions are also good. Your acuity, however, your acuity, your near visual and distant acuity, it is notable as there are significant findings. I'm going to take note of it. Your ears, upon inspection, places symmetrical to the eyes or aligned to the eyes. There's no disfigurements. You do not feel any pain when you touch your auricle or your ears. There's no also pain in your mosaic process behind your ear. No foreign substances when I inspect inside your ear or the backwards rumen or what. And you can be able to repeat all the words from the whisper test properly. And performing the Weber and the reading test all are good as you can hear both sides and there's no abnormal findings at all. So although this is a lot to take in, I'm going to take note of all of it, write it down, and report everything to the physician for further evaluation if there is any assessment that is needed to be conducted. So, do you have any questions so far?
None.
Right, that would be all, and thank you for your cooperation.
Thank you.